This is LiveWell Talk on Inspire for Sleep Apnea, Part 2. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health, St. Luke's Hospital. Sleep apnea is a very common medical condition and potentially serious, potentially life-threatening, where patients stop breathing or their breathing is obstructed while they sleep. Returning the podcast today is Dr. Thomas Heineman, otolaryngologist with Physician Clinics of Iowa, Ear, Nose, and Throat, to share more about the Inspire procedure. Dr. Heineman, welcome back.
Thanks so much. Glad to be here.
Congratulations.
Thank you.
Dr. Heineman's team, led by him, has been designated a Center of Excellence for Inspire implantation, exclusively performed here at St. Luke's as well as the Surgery Center of Cedar Rapids. That's impressive.
Thank you. No, it's been certainly a team effort between the ENT side, who's responsible for the implantation of the device, and then the neurology sleep medicine side, who's responsible for the long-term follow-up and just kind of optimizing the device for each individual patient. So our team consists of myself, Dr. Melanie Giesler, who's in the ENT department, and then as well as Scott Geisler from Neurology Sleep, Dr. Lori Schumann, and Dr. Struthers. Bob Struthers from neurology. So certainly a group effort, but we were very excited. We were the first 4 in the country to obtain this designation, and that's across the whole United States. So it just speaks to the volume that we see. They also award this based on our outcomes. So very much associated with tracking these patients in terms of how they do, whether or not they use it, whether or not they like it, and then also we try to be as objective as possible, looking at the actual reduction in their sleep apnea as quantified by a sleep study. So it's something that we've definitely had a lot of momentum. We've grown this program from our first implant almost 2 years ago to now. I think we'll be doing our 200th by the end of next month, or end of this month rather. So it's now up to where we're implanting around 20 a month, which is definitely up there in terms of volume.
Yeah, I think when we did the first podcast on this, I mean, you were well below 50.
Yep.
I mean, might have been in like the 10s and 20s, somewhere in there.
Exactly. So
yeah.
So we're up there, and I think looking at this quarter, we will implant the second most in the country over this quarter. So that's more than Mayo, more than like lots of huge health systems. We just implanted the second most. So definitely something that we're proud of and something that continues to grow.
I think I would attribute some of that. You have a high-functioning team that's directing these patients to evidence-based care.
Exactly.
As opposed to just one ENT surgeon and one neurologist in a silo, not talking to each other and not getting the patients the best care.
And that was one of the criteria for the Care Team of Excellence Award, which is you have to have at least 2 implanting surgeons and you have to have at least 2 sleep medicine managing providers. So that's where it can't just be one person doing it. It definitely is a whole team. The Eastern Iowa Sleep Center, which is a pillar of our community in terms of managing the sleep, has been great in terms of helping us with getting sleep studies done in a timely fashion. They also are involved in some of the management after implantation with the special sleep study after the Inspire is done. So they're between certainly St. Luke's, the Surgery Center, Eastern Iowa Sleep Center, PCI. It's definitely a collaborative effort, and I think it really encapsulates what you can do when you put a lot of people who care a lot about patients also driving and just trying to adopt technology and cutting edge care. And I think that that's really our goal. And I think the success and the patient satisfaction we've seen with the device and really changing people's lives and changing a lot of the long-term health effects, as you pointed out in the opening about sleep apnea, it's very gratifying. But also, we wouldn't be doing this and we wouldn't see the growth if patients just didn't like it. Or
I was just going to say that. I mean, I think you're at the point now you've crossed that that metric or that threshold to say this device works. Yep. I mean, if it didn't, you wouldn't be where you're at.
Exactly. And again, unlike a lot of the other surgeries we do, as much as we'd like to say that all the care we give is data driven, for most surgeries you do, no one's really tracking those outcomes. I mean, you yourself as a surgeon want to make sure you're doing well and that your complication rates or success rates are within kind of what the norm is for your particular profession. But in this particular case, every single patient we implant, we know how much they're using it, we know whether they like it, and then we know the results from the sleep study that they do afterwards. So those are the three things we want to check in every patient, and we have a benchmark that we want to hit, and that's really, I think, by placing a bar for ourselves just to say that this is something that we want to succeed at by these metrics. That's when we know we're hitting the target that we want.
Now, sleep apnea is so common.
Yeah.
But just for our listeners, could you just tell us what sleep apnea is and how the Inspire device helps?
Absolutely. So, talking with patients about this on a daily basis. So obstructive sleep apnea at a very kind of anatomical level just means that your throat's closing up at night when you're sleeping. So somewhere between your nose and mouth and your lungs, the air is flowing in and then it hits a wall. And what we as surgeons want to do in terms of trying to figure out why that is try to identify where that blockage is. And I simplistically break the throat down into three areas. There's the upper part, which is the soft palate and the nasopharynx. There's the middle part, which is typically the tongue, and the lower part, which is further down in the structures kind of right at the opening of the windpipe. And every single patient with obstructive sleep apnea, one of those three areas is the driver of the obstruction, meaning where that blockage is happening. And so every patient who we see for Inspire evaluation has to undergo an airway exam where we actually replicate a night of sleep. And we try to identify which one of those three areas is the cause of their sleep apnea. Now, this has been, I think, one of the most exciting revolutions in how we think about sleep surgery. Inspire certainly has given us more tools, but the airway exam, it's called a sleep airway exam, really is giving us that key data point in terms of trying to personalize the care. And the most common pattern, which happens, I would say, around 80 to 90% of the time, is that middle level where the tongue falls back. And what the Inspire device is, it's actually a heart pacemaker that was re-engineered to pace the tongue instead of the heart. So they're both muscles. That technology has been around for a long time. But in this case, we know because of the airway exam that the patient stops breathing because their tongue's in the way. So we can't really change the tongue anatomically. We can't make it smaller. We obviously can't remove it. So what we do is we use a technology like Inspire to just kind of nudge it out of the way. And that's where I think fundamentally you see what causes sleep apnea, but then what we're doing to fix it. And that's where the Inspire device comes in.
And you said about 90%.
Yeah, have the pattern where the tongue.
Have you gotten to the point where you see the patient in clinic, you're like, okay, this is
yeah.
I mean,
I think certainly because we've probably done close to 400 of those airway exams or more, and so I think I have a pretty good gestalt for it. It is still, we still are surprised, truthfully, sometimes, and because that airway exam is so quick and very, very, very low risk. It's still a very important step because we want, if you're going to go through the time and the effort and the potential risk of the implant itself, we just want to make sure that it's going to work. It's also required by insurance that we do that airway exam as well prior to implantation.
Well, I mean, but that just common sense.
Exactly.
I mean, you're selecting the appropriate patient,
Exactly.
And so therefore your outcomes are going to be good.
Exactly.
Yeah.
Exactly.
So the Inspire device stimulates the tongue to go forward.
Yep.
And is there any, so I'm going to lay down and sleep, I turn it on. Is there a delay or does it happen right away?
There is a delay. I think the default setting is 30 minutes, enough time for you to fall asleep, but that can be changed to whatever you want. If you're somebody who falls asleep once your head hits the pillow, you could set that at 10 minutes. If you're somebody who's more of a, kind of lay there for a while, you could set it to an hour. But then once that kind of delay time threshold's been reached, the device turns on. Now, in every patient with the device, we want to find a setting that's strong enough to move the tongue out of the way, but gentle enough to not wake you up. And that is different in every patient. And the amazing thing about the technology is that it's extremely customizable. So there's like a million different configurations, settings, modes, strengths that we can do. And that's done through the sleep team. And again, kudos to the sleep side. Yeah.
Not to interrupt, but do they do that remotely? I mean,
well, so now, kind of since our last Inspire podcast, so now all the remotes are Bluetooth. That's been a new development in the last several months. So the remote communicates, so the Inspire device communicates to the remote, and the remote communicates to the app on your phone, and that gets loaded into the cloud. So we can see that patients are using it. We can see what settings they're at, but we can't change it remotely. So the patient still is kind of in the driver's seat. So without getting kind of too much into the weeds, we start patients when they're first, after they're first implanted, at a low level, and they build up one level a week. And they actually change that setting on the remote themselves at home. And the reason why we do that is because the muscle, the tongue, isn't used to being paced at night. And so like training for a marathon, you start slow and you build up, and that muscle gets stronger with time and can tolerate more intense, stimulation than you could right out of the gate. So it does take a couple of weeks for patients to build up. They're going up one level a week to where they're given enough stimulation to move the tongue, but it's still comfortable. But that's a process. Sometimes it takes a little bit longer, just depends on the patient. But that is in collaboration with the sleep team.
And then is it based on the patient's response when you say, okay, we're at the right?
Exactly.
Okay.
So the first thing we go by is subjective, how you feel like you slept. So it's pretty amazing actually, or most patients with obstructive sleep apnea, their default sleep is just quite poor. They wake up tired, they wake up with headaches, they wake up just with low energy, they feel like they need to nap all the time. And sometimes we'll start them at a low level, those symptoms persist, and then they hit like level 4, level 5, level 6, and then they start to say, oh, I woke up this morning, I didn't have a headache. I woke up this morning, I felt like I actually got rest. All of those types of things. And then that tells us that it's starting to work. And then we just kind of have them keep marching up. And then, of course, if it's too strong, you back down, you kind of settle it in. And most patients will kind of find that level just empirically by how they feel. And then we bring them into the sleep center after that, do a sleep study. And that typically happens about 3 to 6 months after implantation.
Okay.
And then we not only confirm that they had a reduction in their sleep apnea as seen by the sleep study. It's pretty amazing actually when the patient goes in, the sleep tech who's kind of managing the sleep study can turn the device on and off as part of they're specially trained to do that. And you'd see them you see the patient, you turn it off, they stop breathing 50 times an hour, just like, once a minute they stop breathing about. And then you turn it on and then there's like, total new normal breathing. You turn it off, stop breathing 50 times an hour, turn it on. So it's like almost a case control trial within themselves that night.
Wow.
And the sleep tech during that study will oftentimes just tweak it if there's a little bit of setting where they know that they could go up just a little bit or down a little bit and get a better response on the sleep apnea standpoint. But then once the patient's, kind of solidified from that sleep study, they follow up once a year and they just keep going. And I think we probably mentioned last time the battery does last 11 years. So, it is a battery change in about a decade, but, compared to CPAP and that battery change is a much simpler procedure anyways than the initial one.
Well, so a couple questions.
Yeah.
Does it make a noise?
It doesn't.
Okay. All right. Silent.
No. Yeah.
Can I have an MRI?
You can now. So also a change since our last podcast, the FDA, as of about 4 to 5 months ago, approved it for whole body MRI clearance. So no restrictions on imaging, mammograms, CT scans, anything like that anymore. So that's been a positive change as well.
So as the patient, it's the levels ramped up. Do they feel it? I mean,
so it's not a buzz or a zap or a shock or anything that you would anticipate, something, an electrical stimulation of your tongue. It's more that your tongue is just kind of stiffening, contracting slightly, and you're not doing it. So that's kind of the best way to describe it, perhaps. Of course, if you really, go very high, you could kind of feel like a cramping or a discomfort, but patients again are ramping up slowly, and it's not, the stimulation is not enough to wake you up.
Can you talk when it's turned on?
You can't, in the sense that every time you breathe in, because that's how the device syncs with your breath, every time you breathe in, your tongue is kind of stiffening. So again, you wouldn't want to drink anything or talk or anything when it's on, but this is something that you're just turning on when you go to bed and you turn off in the morning and you wake it up. So it is, when patients do get it turned on the first time, it's always a little bit of a, they're kind of laughing or like, this is like, feels funny. But after a while, I think they just don't even notice it.
Well, and I think sleep apnea is one of those conditions that whatever you're doing, if it works, the patient, the compliance is 100%.
Exactly.
How am I trying to say this? We used to do this camping canoe trip, and I remember there was a guy that would know me to go on. This was huge. It was the Missouri, and it was the retracing Lewis and Clark expedition. I mean, this is huge.
Yep.
But then he had really bad sleep apnea.
Yeah.
And so he quit going because he would not leave home without his CPAP. Now they have smaller devices, and I'm sure, but it just struck me as like, wow, he felt that much better with it. So I can imagine once people get the hang of it, they're like, I'm not changing this.
Yeah. And when I talk with patients, it's not necessarily if you do well with CPAP, you like CPAP. This isn't. My mission is not to convert everyone with CPAP to Inspire. This is really built for people who, as you've mentioned, maybe from a lifestyle standpoint, maybe they're business travelers, they're traveling all the time.
Right. Yeah.
They can't take their device with them, or these are people who just claustrophobia, can't get a mask to fit. Restless sleepers, they're tossing and turning, they get tangled in the hose. There's a lot of people out there who do struggle with sleep apnea, and for the longest time it was CPAP or nothing, really. Right. And now we see a ton of people coming out of the woodwork who maybe tried a CPAP 10 or 15 years ago and just couldn't tolerate it, and they just didn't think there was going to be anything ever for them. And now there is, and that's why I think what's exciting about medicine is that we're trying to solve problems. We're trying to help people that previously we didn't have a solution for, and now this is available. So it's not for everyone, and not everyone is a candidate, but for the people who are candidates and do struggle with sleep apnea and can't tolerate the mask, this has really I think been a game changer.
Well, it certainly falls under that design of medicine and science is not providing answers as much as just a quest for knowledge. And this is just along that path.
Exactly.
Which is, the scientists and all of us just love stuff like this.
Yeah. Yeah.
Well, once again, this is Dr. Thomas Heineman. Thanks for coming by. No. He's on his way to Atlanta to give a talk on Inspire. So we wish him safe travels. It's been great information. Again, this is Dr. Thomas Heineman, otolaryngologist at Physicians Clinic of Iowa, Ear, Nose, and Throat, discussing Inspire for sleep apnea. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.